Have you ever felt your chest tighten like someone was squeezing it? Maybe you started gasping for air, your heart pounding so hard you could hear it in your ears, and suddenly the room began spinning? Your first thought was probably, "This is it. I am having a heart attack." But what if I told you that 70% of people who rush to the emergency room with these exact symptoms are sent home with a completely healthy heart? What if the real culprit behind these terrifying episodes is not your heart at all, but something far more common and completely treatable? The truth might surprise you. These symptoms that feel so much like a heart attack could actually be your body's way of expressing something entirely different. Something that affects nearly 3 out of every 10 adults over 60, yet remains one of the most misunderstood conditions of our time. If you have experienced chest tightness, difficulty breathing, or sudden dizziness, and wondered what was happening to your body, you need to hear this. Let me ask you something. Have you ever noticed your breathing becoming shallow and rapid when you are worried about a doctor's appointment? Or maybe your chest feels tight when you think about your children or grandchildren facing difficulties. Perhaps you have experienced that unsettling feeling of dizziness when you stand up too quickly, and suddenly your mind races with worry. These experiences are far more common than you might realize. Research shows that 28% of older adults experience anxiety symptoms, yet many people suffer in silence, thinking these feelings are just a normal part of aging. I want you to know that you are not alone in this. Please take a moment to share your experiences in the comments below. Today, I am going to share 4 scientifically proven techniques that can help you distinguish between anxiety symptoms and serious medical conditions, while giving you practical tools to manage anxiety effectively. These are not complicated medical procedures or expensive treatments. These are simple, evidence-based methods that you can start using immediately, right from the comfort of your own home. Each technique takes just a few minutes and can be easily integrated into your existing daily routine without disrupting your life. Let me start with something that might sound almost too simple to work, but I want you to trust me on this one. The 4-7-8 breathing technique is one of the most effective methods for reducing stress and anxiety. Now, I know what you might be thinking. How can something as basic as breathing help with symptoms that feel so overwhelming and frightening? The answer lies in understanding what happens in your body during anxiety. When you feel anxious, your nervous system switches into what scientists call the fight or flight mode. Your heart rate increases to pump blood to your organs faster, and you start breathing more quickly to provide more oxygen to your muscles. This is actually a normal, healthy response that has kept humans alive for thousands of years. However, when this response happens in situations where there is no real physical danger, like when you are worried about your health or your family, it can create those frightening physical symptoms. Here's the fascinating part. Recent studies from major medical institutions have shown that deep, slow breathing exercises actually increase parasympathetic activity in your nervous system. Think of this as your body's natural calm down system. When you activate this system through specific breathing patterns, you are literally telling your body to relax at a biological level. Let me share a story about Margaret, a 72-year-old woman who came to see me after experiencing what she thought were heart problems for months. Margaret would wake up at night with her chest feeling tight, her breathing rapid and shallow, and her head spinning. She had been to the emergency room 3 times, and each time, all her heart tests came back completely normal. The doctors kept telling her it was anxiety, but Margaret could not understand how anxiety could cause such intense physical symptoms. When I taught her the 4-7-8 breathing technique, she was skeptical at first. But within just 2 weeks of practicing it daily, Margaret told me, "For the first time in months, I feel like I can breathe again, and I am sleeping through the night." Here is exactly how to do this technique. Find a comfortable position, either sitting in a supportive chair or lying down. Place the tip of your tongue against the ridge behind your upper teeth. Exhale completely through your mouth, making a whooshing sound. Close your mouth and inhale quietly through your nose for 4 counts. Hold your breath for 7 counts. Exhale completely through your mouth for 8 counts, making that whooshing sound again. This completes 1 cycle. Start with just 4 cycles and gradually work up to 8 cycles as you become more comfortable. The key is consistency. Research shows that breathing interventions are most effective when they include multiple sessions and long-term practice. I recommend practicing this technique twice daily, once in the morning and once before bed. You can also use it whenever you start feeling those anxiety symptoms beginning to build. Now, it is important to mention that if you have any serious breathing conditions like severe asthma or COPD, please check with your doctor before starting any new breathing exercises. Safety always comes first, but here is something that might surprise you even more than the breathing technique itself. What we have discovered about anxiety and physical activity that could change everything about how you manage these symptoms. This next technique involves something you probably already do every day, but we are going to do it in a very specific way that targets anxiety symptoms directly. I am talking about walking, but not just any kind of walking. I am talking about what researchers call mindful movement therapy, and the results from recent studies are truly remarkable. You might wonder why movement would help with symptoms like chest tightness and dizziness that seem to be related to your heart or breathing. The connection is actually quite profound. Anxiety can cause your body to feel like it is not getting enough air, creating chest tightness and making you feel like you are working harder to breathe. When you add gentle, rhythmic movement to focused breathing, you are addressing multiple systems in your body simultaneously. A comprehensive analysis of multiple studies found that movement-based interventions, combined with breathwork, showed significant improvements in stress reduction. What makes this particularly relevant for people over 60 is that the movement does not need to be intense or demanding. In fact, gentle movement is often more effective for anxiety management than vigorous exercise. Let me tell you about Robert, a 68-year-old retired teacher who had been experiencing episodes of chest pressure and shortness of breath, especially in the evenings. Robert was convinced he was developing heart disease because his father had died of a heart attack at 70. After multiple medical tests showed his heart was perfectly healthy, Robert felt frustrated and scared. When we introduced him to mindful walking, he was initially disappointed. "I was hoping for something more medical," he told me. But Robert was willing to try anything. He started with just 10 minutes each morning, walking slowly around his neighborhood while focusing on his breathing. Within 3 weeks, Robert noticed that his evening episodes had decreased by more than half. "The best part," he said, "is that I feel more in control of my body instead of feeling like my body is controlling me." Here's the specific technique. Choose a safe, familiar route, either indoors or outdoors. Start with just 10 minutes. As you begin walking, match your steps to your breathing. Take 4 steps while breathing in through your nose, and take 4 steps while breathing out through your mouth. If 4 steps feels too fast or too slow, adjust to 3 or 5 steps, whatever feels natural for your pace. The crucial element is the coordination between movement and breathing. Studies show that this coordination activates your vagus nerve, which is the main nerve responsible for your body's relaxation response. When you stimulate this nerve through coordinated movement and breathing, you are essentially giving your nervous system a direct message to calm down. As you walk, pay attention to how your feet feel touching the ground. Notice the air moving in and out of your lungs, and observe your surroundings without judgment. If you notice anxiety symptoms starting while you're walking, slow down your pace and focus even more intently on the coordination between your steps and your breathing. The beauty of this technique is that you can use it both as a daily practice to prevent anxiety symptoms and as an immediate intervention when you feel symptoms starting. Many of my patients find that a 10-minute mindful walk can stop anxiety symptoms from escalating into a full episode. One important safety note: if you experience chest pain, severe shortness of breath, or dizziness during physical activity, stop immediately and consult your healthcare provider. The key is distinguishing between the breathlessness that comes from gentle movement, which should feel manageable and rhythmic, versus breathlessness that feels alarming or uncontrollable. Now, while movement and breathing work wonderfully for many people, there is a third technique that addresses something many people do not realize is connected to anxiety. Something that happens in your mind that can trigger physical symptoms before you even realize you are feeling anxious. This technique is based on something called cognitive grounding, and it addresses one of the most overlooked aspects of anxiety in older adults. Research has shown that older adults are actually less accurate than younger adults at identifying the early signs of anxiety. This means that by the time you notice symptoms like chest tightness or dizziness, your anxiety has already been building for a while. The 5-4-3-2-1 grounding technique works by interrupting the cycle of anxious thoughts before they trigger the physical symptoms. When anxiety begins, your brain goes into a hypervigilant state, constantly scanning for threats. This scanning process can actually create more anxiety, leading to those physical symptoms that feel so frightening. Around 14% of adults aged 60 and over live with a mental disorder, with anxiety and depression being the most common. However, what many people do not realize is that anxiety often starts in your thoughts hours or even days before you feel the physical symptoms. Let me share the story of Dorothy, a 75-year-old grandmother who had been experiencing what she described as spells where her chest would feel tight, she would feel short of breath, and the room would seem to spin slightly. These episodes were happening more frequently, especially when she was at home alone in the evenings. Dorothy was particularly worried because they seemed to come out of nowhere. When we worked together to track her thoughts before these episodes, we discovered a pattern. The spells usually happened after Dorothy had been thinking about her health, worrying about becoming a burden to her children, or feeling concerned about her financial security. Once Dorothy learned to recognize these thought patterns and use the 5-4-3-2-1 technique, her episodes decreased dramatically. I never realized how much my worrying was affecting my body, she told me. Now I can catch myself before the physical symptoms even start. Here is exactly how the 5-4-3-2-1 technique works. The moment you notice your mind starting to race or worry, or at the very first sign of physical anxiety symptoms, stop what you are doing and use your senses to ground yourself in the present. First, identify 5 things you can see. Look around you and name them out loud or in your mind. I can see the blue curtains, the wooden table, the photograph on the wall, the lamp in the corner, and the book on the shelf. Be specific and detailed. Next, identify 4 things you can touch or feel. This might be the texture of your clothing, the temperature of the air on your skin, the feeling of your feet in your shoes, or the smooth surface of a table. Actually touch these things if possible. Then, identify 3 things you can hear. Maybe it is the sound of traffic outside, the humming of the refrigerator, or birds singing. Really listen to each sound. Now, identify 2 things you can smell. This might require you to move around a bit or take a deeper breath. Maybe you smell coffee, fresh air, or even just the general scent of your home. Finally, identify 1 thing you can taste. This might be lingering from something you drank, or you might need to take a sip of water or tea. Studies on grounding techniques show that they are effective in reducing both the physical and psychological symptoms of anxiety by redirecting your attention away from internal worry and into present moment awareness. The technique works because it forces your brain to focus on concrete, immediate sensory information instead of abstract worries about the future. Practice this technique daily, even when you are not feeling anxious. so it becomes automatic when you need it. Many people find it helpful to post a small reminder card somewhere visible with the numbers 54321 written on it. The wonderful thing about this technique is that you can use it anywhere, anytime, without anyone even knowing you are doing it. Whether you are at a doctor's appointment, visiting family, or simply at home, you have this tool available to you immediately. But there is one more technique I want to share with you, and this one might be the most powerful of all because it helps you understand the difference between anxiety symptoms and symptoms that actually require medical attention. This final technique is perhaps the most important because it addresses the biggest concern most people have. How do I know if my symptoms are from anxiety or if there is something seriously wrong with my health? This is a completely valid concern, especially as we get older and become more aware of our health risks. The symptoms of anxiety and heart problems can be remarkably similar, including chest pain, shortness of breath, dizziness, sweating, and even a sensation of impending doom. However, there are specific patterns that can help you differentiate between anxiety symptoms and symptoms that require immediate medical attention. Let me share the story of Frank, a 70-year-old man who had been avoiding social activities and staying home most days because he was terrified of having what he thought were heart episodes in public. Frank would experience chest tightness, difficulty breathing, and dizziness, particularly when he was in crowded places or when he had to make important decisions. Frank had been to the emergency room 4 times in 6 months, and each time his heart tests were completely normal. When Frank learned to map his symptoms using this technique, he discovered that his episodes always began when he was feeling overwhelmed or worried. They lasted exactly 10 to 20 minutes, and they always ended gradually without any medical intervention. Most importantly, Frank learned to recognize that his symptoms were related to specific triggers like crowded spaces or stressful conversations. Understanding my patterns gave me my life back, Frank told me. Now, instead of fearing the symptoms, I recognize them as my body's way of telling me I need to slow down and breathe. Here is how to create your own symptom map. Keep a small notebook or use your phone to track 3 things every time you experience symptoms: the timing, the triggers, and the resolution. For timing, note exactly when symptoms start and how long they last. Anxiety-related heart palpitations and chest discomfort typically start suddenly and end quickly, usually lasting minutes rather than hours. If your symptoms come on gradually and persist for hours, or if they get progressively worse, this is more concerning and warrants medical evaluation. For triggers, pay attention to what was happening right before your symptoms started. Were you thinking about something stressful? Had you just received difficult news? Were you in an unfamiliar or crowded environment? Anxiety symptoms are often triggered by specific stressors like relationship problems, financial concerns, or health worries. Heart problems, on the other hand, are more likely to be triggered by physical exertion or may occur without any obvious trigger. For resolution, note how your symptoms end. Anxiety symptoms typically respond to relaxation techniques, breathing exercises, or simply the passage of time. They often improve when you remove yourself from the stressful situation or when you use the techniques we have discussed today. Here are the red flags that mean you should seek immediate medical attention, regardless of whether you think it might be anxiety. Chest pain that feels like pressure, squeezing, or crushing, especially if it radiates to your arm, jaw, or back. Shortness of breath that occurs with minimal exertion, or when you are lying flat. Dizziness or fainting that comes on suddenly without any obvious trigger. Symptoms that are different from your usual pattern, or significantly more severe than usual. Medical professionals recommend that middle-aged and older adults, especially those with risk factors for heart disease, should seek emergency care if their symptoms do not resolve quickly or if they are different from previous anxiety episodes. The key is building a relationship with your healthcare provider, where you can openly discuss your anxiety symptoms. Many older adults hesitate to mention anxiety because they worry their doctor will not take their physical symptoms seriously. However, good medical care includes addressing both your physical and mental health concerns. Keep your symptom map for at least 2 weeks, then review it with your doctor. This information helps your healthcare provider understand your patterns and can actually make both of you more confident in managing your symptoms appropriately. Remember, having anxiety does not mean your physical symptoms are not real or important. Anxiety creates very real physical sensations that can be frightening and uncomfortable. The goal is not to dismiss your symptoms, but to understand them so you can respond appropriately. Now that you have all 4 techniques, let me show you how to put them all together into a comprehensive approach that can transform how you experience and manage anxiety. The beautiful thing about these 4 techniques is that they work together to give you a complete toolkit for managing anxiety symptoms. The 4-7-8 breathing becomes your immediate response tool. The mindful walking becomes your daily prevention practice. The 5-4-3-2-1 grounding becomes your early intervention strategy. And the symptom mapping becomes your long-term understanding and communication tool. Start with just 1 technique for the first week. I recommend beginning with the 4-7-8 breathing because it provides immediate relief and builds your confidence. Once that feels natural, add the mindful walking. Then incorporate the grounding technique, and finally begin your symptom mapping. Research shows that anxiety affects as many as 20% of older adults, but with the right treatment, you can find relief from your symptoms and return to a normal and productive life. The key is consistent practice. These techniques become more effective the more you use them. Remember, managing anxiety is not about perfection. It is about progress. Some days will be better than others, and that is completely normal. Be patient with yourself as you learn these new skills. Your body has been responding to stress in a certain way for many years, and it takes time to establish new patterns. I want you to leave this video feeling empowered and hopeful. Anxiety symptoms can be frightening, especially when they involve sensations like chest tightness and difficulty breathing. But now you have concrete, scientific, practical tools to manage these symptoms effectively. You are not alone in this experience, and you are not powerless against anxiety. Millions of people your age are successfully managing anxiety and living full, active, enjoyable lives. You can be one of them. If this information has been helpful to you, please give this video a thumbs up. Your engagement helps us reach more people who might be struggling with similar concerns. Subscribe to our channel for more evidence-based health information specifically designed for older adults. And most importantly, please share your experiences in the comments below. Your story might be exactly what someone else needs to hear to take the first step toward feeling better. Take care of yourself, and remember that seeking help is a sign of strength, not weakness. You deserve to feel comfortable and confident in your own body, and with these tools, you can achieve that feeling. Until next time, breathe deeply, move gently, and be kind to yourself.